Angel's here. My student ID number 391441. Today I will be performing a staple removal along with a dressing change. I have Mr. Clark. I'm a practical nurse learner caring for Mr. Thomas Clark, who was diagnosed with colorectal cancer 4 months ago. 14 days ago, he had a left hemicolectomy. It's a surgical removal of the descending colon. Today, he is due to have his staples removed. I have the scenario right here, along with the patient label. And I have the physician order. I'm just going to read it out loud so we know what we're doing right here. My physician order states that I have to remove alternate staples on day 14, which is today, and I also need to apply sterile strips and then cover with sterile gauze 4x4 and remaining staples, remove the remaining staples on day 15, which is tomorrow. On the file, we have Mr. Clark. He has allergies. I need to confirm that with the patient when we get there. I'm gonna go to the shelf right now to grab all my supplies so we can go meet Mr. Clark and remove his staples. At the shelf here, I need to grab my stuff. So I have a blue pad, which is the very first thing. I also have a dressing tray. It's unopened, it's sealed, and I check for my expiry date, February 14, 2022. We're good to go. I have my staple removal, also sealed and unopened. Expiry date I have July 3rd, 2022. I have sterile strips right here, also sealed and unopened. Its expiry date also 2024, December. I have tape and then pen. I need it to label the dressing change again. And then I have gauze 4x4, just like the physician order. I grabbed one more just in case to have, when we check the drainage, we'll see what's going on. Now we're heading, oh, sorry, before I forget, I'm gonna check also, I need normal saline. This is very important. This is my first check for the normal saline. I have sodium chloride, 0.9, and then I have the expiry date, March 20, 2022. Now we're good to go. So I'm gonna go see Mr. Clark and remove his staples. I go to Mr. Clark. Hello, Mr. Clark. How are you doing? First thing I do is I wash my hands and then I adjust the bed to my working height. And then how are you doing? How are we feeling today? Are we good? Mr. Clark confirms. I'd just like to confirm your ID, please. Can you state your name for me? Mr. Clark says that he has, his name is Clark Thomas, and then I asked Mr. Clark to confirm his date of birth. He also states December 6, 1952. I make sure I have the right information. We're good to go. Before, I'm not sure if I mentioned this, but I need to adjust the bed for a working height, appropriate working height, and I also need to make sure that the bed rails, of course, in a hospital setup, I would have that there. Just like the lab, so if it's up, I put it down so I can allow access. If it's not, then I make sure that I have a complete access to Mr. Clark. Mr. Clark, do you have any allergies? Mr. Clark confirms that he has allergies for penicillin. That's good to go. We're good. Okay, I'm gonna set up my supplies. Would you mind if I put my supplies in the bed? Mr. Clark confirms he is okay if I put my supplies there. Before I do anything, I need to put some gloves on. I would like to clean the table, make sure that it's clean. Any food crumbs or juice or coffee drops, just to make sure that it's sterile, because this is where I'm going to be placing my dressing tray and everything. I have my cavi wipes right here. I have my cavi wipes and then I clean it. Everything is clean and good, and then I'm done. I remove it along with my gloves. I use proper techniques. No touching. There we go. And then I drop it in the garbage. I'm going to wash my hands one more time. We're good to go. Now I'm going to place my items. I have my blue pad right here. And And then I'm gonna grab my a dressing tray. I'm gonna do my second chick. It's unopened again, it's good to go. So I'm gonna have it right here on the table, right beside me. I'm just gonna mention that, of course, since we're doing this at home, this is my wound right here because I'm gonna be caring for the wound. And what else do I need before I prepare anything? Okay, I'm just gonna put my supplies right there. I have the gauze, and then I have this one, so I'm just gonna have this right here so I have easy access to it. Okay. I wash my hands one more time, and then now I'm gonna open my dressing tray. I make sure that I open it away from me. Good to go. I'm gonna place it right here where I have access to it. Right here on the table, so we're good to go. I'm gonna grab my forceps carefully because I cannot contaminate the dressing tray. I'm gonna grab it slowly so it can open. I'm gonna check where's the shiny part. Oh, I think it's the other side, so I'm gonna grab it from the edge here and then place it down slowly. And this is my sterile field right here. I'm gonna grab with my sterile forceps right here. I'm gonna place it right here on the edge. I'm gonna grab my other one. I'm gonna use my gauze as well. Right here, I have everything ready. Good to go, and I'll place this right here. I'm gonna wash my hands one more time. And then I'm gonna put let's pour our saline. So when I pour, I'm gonna do my second check for my normal saline, sodium chloride 0.9, expires March 2022. So I'm gonna go ahead and open it. This is my second check. I'm gonna pay attention that I don't pour too high up so it doesn't splash, and not too close so it doesn't contaminate it. I drop it, we're good to go. Put it away. Now I'm gonna put my gloves on because I'm gonna check the wound. I need to check the wound, and I need to make sure for risk of exposure that I am well protected. Okay, now I'm gonna check the wound, and I'm gonna slowly open it from the side right here. I'm just gonna peel off the dressing, Mr. Clark, slowly. Here we go. Okay, here we go. I check the wound and I check the drainage. The gauze, I see no drainage, so I can't tell you my taco. I can't tell you the type, the amount, the color, or the consistency, or the odor. I cannot tell you anything because no drainage noted. I check my incision. I check for, of course, my RIDA. I have my redness, edema, ecchymosis, and then drainage. There is no drainage on the incision, so it's well approximated and it's good. And of course, my last one is approximation, which is I see the wound well approximated. I also assess for the staples. I have 2, 4, 6, 8. I have 10 staples just before I start my procedure. I'm gonna throw this in the garbage right now. I'm gonna discard. We do proper dropping. This is good. So I'm gonna wash my hands one more time. And I am gonna reach for my incision and I'm gonna clean it. And after I clean it, I'm gonna use the staple remover so I can take every other staple. Before I do that, I need to put my gloves on to make sure that I'm doing it right. because I'm gonna come near to the incision. Here we go. I have it. It's well good. Now I'm gonna reach for, oh, I'm gonna make pillows. I'm gonna grab this. I'm gonna make my first pillow. I'm gonna go dip it in normal saline. Remember that I'm gonna do this, so even if it drips, so sterile to sterile is fine as long as it doesn't drip on my sterile field. I'm gonna go for the furthest first, then I finish, I drop it, I discard, and then I go for my second. This is good to go. And I do the same thing, just make sure that it doesn't trip over my sterile field. I'm gonna go from here. This is clean and good. I'm gonna discard. There we go. And I'm also gonna do it the third time. And I'm gonna pass this through in the middle. I felt as I was moving it, it was almost getting stuck to the staples. So just in case, I'm gonna dab. If it was way smoother, then I would just go one on it and that's it. Okay, this incision is good. If you can look closer here, if you can see the staple got stuck to it, that's why I had to dab on the staple, on the incision. Anyway, this is good, so I'm gonna discard. We're good to go. I have a gauze right there. I'm gonna let it air dry so we can remove the staples and then, you know, apply new dressing. So I'm removing the gloves again. I'm gonna wash my hands again. And as for Bow Valley policy, I have to use my staple removal and I have to apply gloves again to make sure that the staple removal, it has to stay sterile for the incision. There we go, we're good to go here. So I'm gonna grab my staple removal and I'm gonna peel it off just like I'm peeling a banana right here. I'm gonna grab it slowly. We're gonna make sure that this is sterile. Grab it right here. I'm gonna place this right here on my blue pad. Actually, here, I'm just gonna take this out. Oh, it's not coming out. Okay. Actually, since I'm wearing gloves, I can just put it right there. This is here, and I'm gonna discard this one. Okay, now I have my stapler. I'm gonna put the two teeth at the bottom. I need you guys to pay attention that I'm not gonna remove the edges or the end of the stapler. I'm gonna alternate. So I'm gonna reach for the bottom teeth and then pinch, wiggle, and it's out. And I'm gonna place it on this gauze. Oh, it's not coming out. In this situation, what do? I have to grab for my forceps and I need to grab it slowly. Here we go. This is good. I'm gonna put this right here. I'm gonna go reach for another staple. Pinch, wiggle, and then slowly take it out. I'm gonna try to let it go. It's not going. Oh, is it going out? Oh, no, it's not going out. I'm gonna have to do the same thing. Here we go. Drop again. I'm gonna go reach for my third one. Pinch, wiggle, and then one more time. Oh, here we go. This one dropped. Okay, this is good. So I'm gonna drop it right here. This is good. Now I'm gonna reach for my sterile strips so I can open it. So since this is my sterile field, just in case, I'm gonna remove my gloves again. I'm gonna wash my hands again, and then I'm gonna reach for the sterile strips because we need to maintain sterility. So again, I'm gonna remove my gloves. There we go. I'm gonna wash my hands one more time to make sure we're good, we're clean, we're sterile. And then I'm gonna reach one more time. Should have let my hands dry a little bit. But anyway, we're good to go. By the way, I don't know if I mentioned this, but I'm not allowed to turn my back to the sterile field, so I don't contaminate it. Now I'm gonna reach for my sterile strips, and I'm gonna show here. I'm gonna peel it just like a banana. Before I also remember that I'm gonna check it again. I'm gonna check the expiry date and it's unopened. I reach open. I'm gonna have to use, here we go, this is opened. I'm gonna place this right here, right here. So just like, if you guys can see, I'm gonna reach only the edges. In the middle, it's sterile, it's good. So I'm gonna pull the edges of the incision together, and then I'm gonna place my sterile strips. I'm gonna go reach for one more. As I mentioned again, I'm gonna reach only for the edges, just like a bandage. You only touch the edges. And pull the incision edges together. We're good to go. Of course, it gets stuck to the gloves, but we're okay. The last one, here we go. The middle is sterile. We are good to go. Here we go. I'm just gonna apply. Now I need to apply my gauze. Reach for my gauze. Since I didn't have drainage, and the incision is well approximated, there's no drainage. This is not opening. There we go. I'm going to peel it just like a banana. I'm going to make sure the inside is sterile because I'm going to place it on the incision right here. I'm going to reach my forceps here, and I'm going to place it on the incision. Perfect. Now I'm going to discard this one. I'm going to reach for my tape. I need to write the date of today. We have February 13, and then the time 15:45, and then my designation P and L. This is good to go. We make sure that we don't write on the patient. There we go. I'm gonna place it. Of course, it's a little hard to work with gloves, especially with tape, but we got this. There we go. And then the last one, I'm going to place it right there. How are we doing, Mr. Clark? Are we good? Mr. Clark confirms that he is okay. There we go. Now that we are good, before I start taking everything away and discarding everything, I'm going to make sure that I'm going to count my staples on the pad, on the gauze that I have here. I forgot to mention when I was looking, it's so like when I was, before I put the gauze, I looked at the incision again. I should have verbalized that out loud, and I should have said that there was so we had 10 incisions, 10 staples. So I put, oh no, what am I saying, 10, it was 7 staples, and then I have removed 1, 2, 3. I have the staples right here, so they're good. I have all my items here. I didn't miss anything. Everything is clear in front of me. Now that we're done, I'm gonna put everything away, and then I'm gonna go and I'm gonna talk to Mr. Clark. I'm gonna make sure that we have everything. Before I put everything away, here, let me just drop this out. Let me wash my hands one more time. I'm just gonna do my third check of my normal saline. I have it here. Since I opened it, I have to remember that I have to label again with my P&L, Angel Abu Ghosh, and then I have expiry date. It says here March 2022, but then of course since I opened it, I have to label it with the date of the time and my name on it before I put it on the shelf for the next use. Now that I need to discard everything, of course I have to make sure that I wear my gloves again, and then I wrap up everything. So I have my gloves on, and I am gonna throw my staples, of course, and then my staple removal, and then all my forceps, all of them, they have to go to the sharp container. So just gonna pretend that this is my sharp container. I'm gonna drop it all here, and then I'm gonna have to drop everything here. This is the wound, of course. I'm just gonna place the wound right here, and this is my stuff here. I don't need this anymore, so I'm gonna all fold it, and then we're good to go. So this is all good, and I'm gonna discard everything, and I'm gonna throw it in the garbage. This is, let's say this is garbage. I am good to go. I remove my gloves, and I wash my hands one last time before before I need to, okay, so we're done the procedure. I wash my hands. Now the bed, as when I started the procedure, I put the bed height, it was up. So now I need to put it down for patient safety, and I'm gonna lift up also the bed rail up to make sure, again, for patient safety. Now I'm gonna make sure that Mr. Clark, I'm gonna pass Mr. Clark the bell. I'm gonna make sure that he's comfortable if he has any questions, and I'm also gonna mention for Mr. Clark that if you need to take shower, you need to make sure that the incision, that the new dressing is dry. Do not get it wet, do not scratch it, do not itch it, do not do anything. Please keep it clean and dry. I reach out for the bell button, I give it to him, I make sure that he's safe. The bed is in a perfect position. It's not too high and it's not too low. It's good for the patient comfort. The bed roll, again, I make sure that it's good. I finish my procedure. I took my stuff away, and then that's about it. I finished my procedure. That's it. Thank you so much.